Hello. Thank you guys for attending my speech today. According to the National Institute of Mental Health, about 1 in 4 adults aged 18 and older suffer from a diagnosable mental disorder within any given year. Schizophrenia is commonly thought of as a rare disorder, but actually it's very common, around a 1 in 100 lifetime risk of the disorder. What is schizophrenia? According to helpguide.org, schizophrenia is a chronic disorder that affects the brain. It affects the way a person acts, thinks, and sees the world. People with schizophrenia may see or hear things that do not even exist, speak in strange or confusing ways, or even feel like others are trying to harm them. The average age for the onset of schizophrenia in men is 25, and for women the typical age of onset is 30. In rare cases, schizophrenia can even affect small children. In general, the earlier schizophrenia develops, the more severe it is. The most common signs of schizophrenia include social withdrawal, inability to cry, depression, odd or irrational statements, and oversleeping or insomnia. Symptoms of schizophrenia include delusions, hallucinations, and disorganized speech and behavior. The 3 types of schizophrenia are paranoid, disorganized, and catatonic schizophrenia. Schizophrenia can cause relationship problems, alcohol and drug abuse, and risk of suicide. With support, medication, and therapy, most people are able to function in society and live satisfying lives. It is best when schizophrenia is diagnosed early and treated right away. It is important if you spot signs or symptoms of schizophrenia in your loved ones that you help them seek medical treatment right away. Causes and risk factors of schizophrenia. According to the Mayo Clinic, the precise cause of schizophrenia is unknown, but researchers have identified factors that increase the risk of the disorder. Those factors include family history of schizophrenia, exposure of toxins or viruses in the first and second trimester of pregnancy, stressful life conditions, and older paternal age. There is no way to prevent schizophrenia, but researchers hope to continue learning more about risk factors that would lead to earlier diagnosis. Scientists also believe that an imbalance in the complex, interrelated chemical reactions of the brain involving neurotransmitters dopamine and glutamate also play a role with the disorder. In addition, the brains of people with schizophrenia look different than those that have schizophrenia. Fluid-filled cavities at the center of the brain, called ventricles, are larger in some people with schizophrenia. The brains of these patients also tend to have less gray matter and more or less activity in certain parts of the brain. Once a person is diagnosed with schizophrenia, a psychiatrist usually guides treatment. Treatment may also include psychologists, social workers, and psychiatric nurses. According to the National Institute of Mental Health, because the causes of schizophrenia are still unknown, treatments focus on the symptoms of the disorder. Treatments include antipsychotic medications and various psychosocial treatments. Antipsychotic medications are thought to control symptoms by affecting the brain neurotransmitters, dopamine and serotonin. Some patients refuse treatment because of the side effects such as drowsiness or blurred vision from the medications. Those who are uncooperative may need to be given injections rather than pills. Medications include Abilify, Seroquel, and Thorazine, among others. Psychosocial treatments include social skills training, family therapy, vocational rehabilitation, and individual therapy. Patients with schizophrenia may stop taking medications because they feel better or do not feel they need the medications any longer. By doing this, they experience a relapse and their symptoms could come back or even get worse. In closing, we have learned that schizophrenia affects the way a person acts, thinks, and sees the world. The precise cause of the disorder is unknown, but symptoms can usually be controlled with medication and therapy. Common signs include social withdrawal, depression, and odd or irrational statements. Again, it is very important to seek medical attention for you or a loved one as soon as you see or experience symptoms. You can also contact the Mayo Clinic or National Institute of Mental Health for further information. Thank you guys so much for attending my speech.